Dr. Joe Vipond has been a outspoken voice on Canadian public health policy, particularly in Alberta, since the beginning of the pandemic. He's very concerned about the recent changes to public health policy in Alberta, basically declared the pandemic over, and he's organized and led a couple of protests, including some in Calgary and Red Deer. So we're going to talk to him about that. So welcome to the interview, Joe.
Thanks for having me on.
Look, let's start with your argument about why the Kenny government and Dr. Deena Hinshaw, the Chief Medical Officer for Health in Alberta, are wrong in their recent changes in policy.
Well, I mean, the most obvious thing is there's no other country in the world, no other jurisdiction in the world that is doing this. If it was such a great policy, you'd be expecting a lot of people to be jumping on the bandwagon. But if you just want to talk about math and biology, the reason why this is wrong is, well, they're doing two things. It's really important to be explicit as to what the consequences of these two things will be. Number one, the numbers will all be hidden. We'll have no idea of what the amount of illness is in the system, except for hospitalizations, ICU, and wastewater COVID numbers. So those will be the only kind of representation as to how bad it is. And basically, they're hiding the numbers, they're hiding the outbreaks. That's the first consequence. The second consequence is because of the extremely transmissibility of the Delta variant, which is now seen to be as transmissible as chickenpox. We're going to have this go rampantly through society, in particularly amongst our 12 and unders and those that are chosen to be unvaccinated, which I want to point out the government has allowed them to make that choice. So, and then finally, we're going to have breakthrough cases amongst the double vaxxed, and that's going to have extreme consequences for our healthcare system. And also, we know that there's long-term disability associated with getting COVID, likely also with those breakthrough cases, but for sure with anybody who's unvaccinated and for sure with those kids. And that means anywhere from like 8 to 30% of every infected individual going on to have long-term disability, which is incredible. I can't believe we're inflicting this on our society. It's criminal, really.
My take on this, Joe, is that the current situation, I mean, vaccines are working marvelously well. I'm double vaxxed, you're double vaxxed. Most people I know are. 70% roughly in Alberta and BC are.
Alberta, it's around 65% of the population. So
gotcha.
Are single vaxxed, and just over 50% are double vaxxed. So it's much less than those numbers.
Okay, fair enough. But the argument I'm going to make here is that this is a time for caution, not throwing caution to the wind. But if we're going to open up, and we already have opened up quite a bit in many of the Canadian provinces, then the issue there. COVID-19 is still enough of a threat that we should be cautious in whatever we do going forward, not simply declaring the pandemic over and abandoning people to whatever happens.
Let's be clear though that this isn't just about risk. When we were going into July, people were asking me if there was going to be a fourth wave. I said, we just don't know enough about how the impact of the efficacy of the vaccine versus the high virulence, high transmissibility of Delta, how that was going to impact the numbers. But it's quite clear that we're in a fourth wave here. We have exponential growth of cases. They're rising about a doubling time of every 5 days in the province, in particular in Calgary. And so it's clear that we're in a fourth wave. And instead of managing that fourth wave, they're trying to hide it and arguably trying to enhance it, trying to make it worse by their actions. So this isn't just about risk. This is actually about, we know the consequences and they're going to be bad. There's just no doubt about it.
So what are other provinces doing? What are other jurisdictions doing, instead of taking Alberta's approach?
Yeah, I mean, BC's, your province has been not particularly great from the beginning. They've always kind of hid the numbers by suggesting people with low symptoms, like mild symptoms, not be vaccinated. At least they're continuing to do outbreak management, but BC's basically eliminated most of their public health guidelines, with the exception of the interior BC, where there's an outbreak currently. Ontario, I think, has been surprisingly cautious. and I'm proud of them because they have shown the ability to learn, and that has been unique in the country. I wouldn't say unique because Quebec has also shown that ability to learn as well. They have incredibly low numbers, and it's because they've learned through the pandemic. They were hit really hard in wave 1 and wave 2 and really haven't suffered the same third and now fourth waves that other provinces are occurring. And then, of course, a hat tip to the North and to Atlantic Canada, who've put in place COVID zero style policy, which has really helped them economically and, of course, from a health perspective. So that's kind of been the spectrum of things.
Okay, so you've laid out the argument for, reinstating some sort of pandemic management, data collection, and so on. Now you're organizing more protests this coming week. Tell us about those.
Yeah, I mean, I don't know how else to shift policy that is so incredibly anti-democratic, so incredibly dangerous, except for mobilizing the people on the streets. So today will be day 4 of protests in Calgary and Edmonton. I understand there's also protests going on in Red Deer at this time. And yeah, they're growing every day. Yesterday, we started off with 400 on Friday, 500 on Saturday, 750 reported yesterday. Who knows what the numbers will be today? We know Councillor Jody Gondek will be speaking in Calgary, and Heather McPherson, the NDP MP up in Edmonton. So we're attracting some political attention. We've had cameras every single day. I mean, this is I don't know what the end game of the UCP is, because it's going to turn out badly. There's going to be a lot of death, long-term disability associated with this. How does that feed into their electoral fortunes? I would argue that the UCP MLAs need to think about the electoral consequences of tying themselves to Jason Kenney's policy.
Before we end the interview, Joe, there's one question that keeps coming up on social media I see over and over again, and that's from parents. Because, when the original variant, we were told that kids under 12 were pretty safe, they weren't getting infected. And we're now seeing some evidence that with the variants, particularly Delta, that isn't the case. Now kids maybe are getting infected. How worried should parents be?
Yeah, I mean, I think the attitude of the government has been, if you have elected not to get vaccinated, you will suffer the consequences, and we're okay with you getting sick. That's essentially what's been communicated, even through Dr. Hinshaw's tweets, which I think is incredibly immoral and unethical. But the children don't even have that choice, right? They don't even have the opportunity to be vaccinated. So that means everybody who's 0 to 12 will be exposed to this. And because there's essentially no mitigation policy being put in place in schools, they're basically saying, we're going to let this rip through. It's almost like a herd immunity strategy, right? Like if we just let everybody get sick once, then we don't have to worry about it in the future. Unfortunately, no jurisdiction in the world has successfully done that. But there are consequences for kids. It's not an entirely benign illness. This is not the flu. This isn't even chicken pox. So about 8 to 13% of kids will go on to have long COVID. That's a long-term disability, cognitive dysfunction, fatigue, shortness of breath, loss of taste or smell for chronically, we don't know for how long, may come back, may not, we don't know. And that's incredibly sad. That they're exposing the kids to that. And even if mortality is incredibly low, like 0.05%, let's just say that's the number. When you have 100,000 cases of COVID, just picking a number, that would be 500 kids, right? Let me just make sure I got that right. 5,000 is 10%, 500, so 50 kids, 50 deaths. Are we okay with 50 deaths? Are we okay with, is that an okay thing to have 50 0 to 12-year-olds die? It may seem like a small number in the context of Alberta, but to those 50 parents, to those 50, the brothers and sisters of those 50 kids, it's a huge number.
What do we know about the infection rate in kids that age? Are infections increasing? Where are we at with that?
big increase through Stampede was in the 20 to 29-year-old age, although there were increases in the 5 to 19 numbers that I saw online. But now that we are no longer going to be reporting numbers, it's going to be hard to tell. We'll basically have no idea going forward. So parents will be flying blind. It's incredibly dangerous in a democratic society to be taking away key information so that we can make good choices on how to protect ourselves.
Is there evidence that infections in children are increasing in other jurisdictions? I think in a previous conversation, you mentioned pediatric hospitals in Texas being full of kids with COVID. Is there strong evidence or is this, weak anecdotal evidence?
No, I mean, there are stories out of Texas that hospitals are filling up in other southern states. It seems to be a combination of COVID and RSV, which is another respiratory virus, maybe even co-infections of the two viruses. But let's be clear, even if this is other viruses, the mitigation practices we put in place as far as masking, physical distancing, avoiding indoor spaces that are poorly ventilated, poorly filtrated, those mitigation practices work equally well for all respiratory viruses. That's why we haven't seen any flu. That's why almost nobody's gotten any colds this year. So this idea that Alberta is going to pivot to protecting society from these other viruses, which Dr. Hinshaw has suggested are just as dangerous as COVID, is gaslighting.
Joe, thank you very much for your insights. Really appreciate it.
Thanks for having me on.